Day. I am H. Robert Silverstein, MD, for the Preventive Medicine Center. If you have any questions about this program, please call me at 549-3444. Now, I'll try to contain myself as I'm very enthusiastic today. I have the day off and I'm doing this show. First of all, I want to talk to you about a spiritual experience. I think I did talk about this on the last show. I was watching CPTV and they had Australian Pink Floyd. And towards the end of that show, they play Comfortably Numb. And I referred to it, I believe, on the last show, and I want to refer to it again today as a spiritual experience. And that will be the case for some people. What is a spiritual experience? It is sort of when you are removed from the reality of where you are and filled with a degree of awe and gratitude that you're completely absorbed in and virtually absorbed in nothing else. And that is the true spiritual experience. You can have that at various places, and mine last night was watching CPTV and Australian Pink Floyd play the song Comfortably Numb, which went on for a very long time. I happen to love the guitar, and I happen to love the Fender Stratocaster. There's a Telecaster and a Stratocaster, but I like the Stratocaster better. And that's sort of the classic that most rock groups use, not all. Australian Pink Floyd is coming to Hartford at the Dodge Auditorium in the North Meadows sometime in October. So you might want to check with CPTV to see about getting tickets to that because they had tickets available. Next, I want to talk about a type of exercise that is called whole body vibration. And I did not bring this catalog in the last time, but here it is. You stand on this platform here, and you can hold on to the handlebars there. You'll need someone to assemble it. I really recommend this. The granddaddy of the, there are many exercises that you can do on this, and here is literally a whole page full. And what we have here is she's sitting on it straight ahead, arms on her knees. Here she's holding one arm off to the side. Here she's stretching with her arms up in the air. Here he has one leg on, one leg off. Here he's twisting. Here's another one where you're sort of stretching. And they have various of these. This happens to be the power plate, which can be tested at West Farms Mall right here. This is an expensive machine. That machine sells for right at $1,000, give or take a couple of $100. If you have any questions about this, please call me. The power plate is available in West Farms at Brookstone, one of my favorite stores. And the price on this one turns out to be $4,500 in the Hammacher-Schlemmer catalog. So if you wanted to look this up and study it, you would go to, you could first of all go to Google and put in MY, then the number 5, power plate, and you'd learn about it. Or you could simply write in whole body vibration, whole body vibration. And you can see the picture here. This is a, what did I say, $4,500 machine. The other one is about $1,000. And in a certain sense, you get what you pay for. Next is a picture that came to my attention. And this is a picture of bug bites, bed bug bites. And it has these pictures. I've never had anything like that. I want to show you the 5-second folding bicycle right here. You sit there. The handlebars are here. And this sells for $800. Now, we have excellent bike shops around West Hartford, and I encourage you to go check those out. They probably will sell. This is again in Hammacher, HAMMACHER.com. And they don't give the name of the, let's see, the name of this. It'll handle people between 5 feet and 6 feet 4 inches tall, rear disc brakes, aluminum alloy wheels, front and rear fenders, 30-pound capacity luggage rack. It certainly looks strange, but it's foldable. That's the nice thing about it. It's foldable. To my surprise, I read this article. This is from what we call a throwaway. This is Internal Medicine News, August 15th. And what it shows is high coffee intake may increase the risk of rheumatoid arthritis. Who would have thunk it? So coffee intake may be related to rheumatoid arthritis. Now, I have a whole series of papers that I want to quickly go through that have to do with cancer. Cancer is on everybody's mind. And you might say, what's a cardiologist doing talking about cancer? Well, I am from the Preventive Medicine Center, and it is not about preventing one disease. It is about the real preventive medicine of preventing virtually all diseases. High blood pressure, high cholesterol, diabetes, cancer of the breast, uterus, prostate, colon, heart attack, stroke, dialysis, blindness, and so on. Well, the first product that I want to mention is a book by the Life Extension Foundation called Disease Prevention and Treatment. And in there they have a section called Cancer Treatment, the Critical Factors. And then they also have another discussion of should cancer patients take dietary supplements. Most cancer doctors, most oncologists, do not recommend the use of antioxidants. I suggest you read for yourself. I'm not trying to create a problem. I'm trying to offer people an opportunity for education. The concept is an invitation to consider. And you take this information, and then you read it and talk it over with people. If you need to, call me, 549-3444, and I will give you my 2 cents in how I would go about it. Next is, what would I take if I had cancer? This is MCP, modified citrus pectin alginate. And that would be one product that I would take if I had cancer. Avamar, and graviola are a couple of herbs that I would also take to enhance immunity. That's what those are about. Vitamin K2 may protect against prostate cancer. If you remember my usual position on, there are 2 vitamin Ks. There's K1 and K2. And if it doesn't say K number 2, then it's not K2. This is an antagonist to the medication warfarin or Coumadin. So if you have any need for those things, then I would be very careful about taking this. I did read one article that implied that you could simply adjust your your warfarin therapy, but I can't imagine how the vitamin K2 would do you any good if you were antagonizing it with the warfarin. In any case, it says vitamin K2 may protect against prostate cancer. And my position has always been that you take whatever supplement that you're going to start, and you really shouldn't take too many. What constitutes too many? The truth is, and I don't mean to be ridiculous with this, the truth is that any is too many. We should all be well. We should have no health conditions. We should be eating a brown rice, vegetable, bean, fruit, nut, seed, fish once or twice a week type diet. In place of the fish, you might want to substitute free-range chicken, cage-free eggs, bison, but that's only if you're exercising 30 minutes 6 days a week. Since I got my television hooked up for my treadmill, I'm now using it, and yesterday I used it 38 minutes. Am I proud of that? But hey, keep trucking. I'm just getting started.